So you do so many amazing procedures in our office. You mentioned implantology. I know you place a tremendous amount of implants in our office. You do some teaching, which we'll talk about shortly, about the implants. But the question I often hear is, should I have a periodontist place my implant? Should I have an oral surgeon place my implant? Dr. Mars, can you place my implant? And in our office, we have such great specialists here with you and an oral surgeon right here under one roof. I never would consider placing an implant. Why should somebody go see a periodontist or an oral surgeon?
Well, it's kind of a loaded question, Dr. Mars, but I'll tell you this,
and by the way, we're going to ask the oral surgeon the question when we interview him.
So right, now that I know that, I'll give you my honest answer.
Okay.
As a periodontist, I was trained in the field of implantology. So we do a lot of treatment where we'll replace missing teeth with implants. We will remove teeth that have a hopeless prognosis, meaning that they're broken down too much or they have too much infection that we can't save them. And so from start to finish, we'll be involved in the care of a patient who requires dental implants. I think something that sets apart periodontists in general from a lot of the other dental professionals that are in the implantology world is that we're really trained to manage soft tissues. And I like to say it's not about the picture, it's about the picture frame. And so I think in order to make a tooth restoration on an implant restoration look really natural, it's not just about putting that titanium screw into the bone, it's about making it look like a real tooth. And the way to do that is by making sure that the tooth has healthy bone and healthy soft tissue around it so that picture frame is beautiful. Gums.
Comes out to look great. Well, what a lot of your patients don't know, a lot of the dentists watching this YouTube will know, is in your field you're a bit of a celebrity. Okay?
An instant celebrity.
Instant celebrity, meaning he's a big star on Instagram, and not just on Instagram.
Whatever that means.
Right, exactly. Well, it's important these days because I know for a fact there's a lot of dentists out there that follow you who want to see what you're doing. I know a lot of the big implant manufacturers and bone companies and membrane companies, they like having you use their products because they know you have a great reputation. You'll only use the best. Along with that, you also teach, and you've gotten very well known in the teaching world. I had the thrill of watching you teach just a few weeks ago. You teach some great procedures, grafting procedures, things like that. Can you talk about some of the things that you do in your practice that really do make you unique and set you apart in terms of, a lot of people have, exposed roots in their mouths and they want to cover up those roots. Let's start with that. Talk about what you do there.
Look, I think, I want to say the Instagram thing has been really an incredible outlet. But really why it started is because I was really always addicted to getting better and to taking photos, right? And a lot of times we use photos for patients because patients want to see what the before and the after can be. And for me, it was always very important that, if we didn't have a record of where the before was, how would we know where we ended up? And so I was, me, I've been taking pictures for, since I graduated, and I really started finding that I was getting better because I was going back and really studying the work. So when I saw other doctors posting on Instagram, I really said to myself, well, I got great cases just like this, and I feel like it took me 10 years to learn from some of my mistakes. I could show this right now, and I know 100 people out there are going to look at it and say to themselves, wow, I just learned something that took 10 years for this guy to learn. And so that's really why I started, taking a lot of pictures and posting, because I've always been very involved with education. I do teach, a couple lectures throughout the year at Nova Southeastern University, which is my alma mater. And because of Instagram, it's just connected me with a lot of, great people. One of my partners is Dr. Israel Putterman in Washington, D.C. And together, we teach courses on bone grafting, soft tissue grafting, and then implantology, like we mentioned. And so soft tissue grafting is one of those procedures that, is pretty much restricted to periodontics, right? That's something that periodontists do. But it's one of those procedures that gives us a lot of satisfaction because we'll often see patients that come in with gums that are receding, and either it's really uncomfortable for them because maybe the teeth are very sensitive because it's cold, maybe they don't like the way it looks, but it's a treatment that we can actually repair, that we can fix. And the way we do that is usually by doing something called a soft tissue graft. And so we can take tissue from an area right next to where, the area that has the receded gums, and we can actually regrow gum tissue. And that's really an incredible thing. The field of dental, regeneration has come a long way. Not only that, there's option biomaterials now that have been developed because of the need, this need to regenerate lost bone tissue and soft tissue and tissue around implants, that there's a lot of new technology that's come about that's allowed us to really get even better at this. So probably 50% of my practice would be implantology and soft tissue grafting like we're talking about. And then the other part is the periodontal disease that we talked about earlier, traditional perio.
So one of the most amazing things that I've noticed about you being in our practice is, and it's developed over the years, periodontal disease, and a lot of patients who had treatments in the past know that a lot of the procedures traditionally have a reputation for being extremely uncomfortable. One of the things I've noticed in recent years of having you in our practice, I almost never hear about discomfort. Post-surgical pain is so greatly reduced these days. I mean, oftentimes we have patients come in and say, I don't even take an aspirin afterwards, doc. What is the secret? Why have things changed so much, do you believe, where patients are so much more comfortable today in your chair than they had been traditionally in a lot of periodontist chairs?
That might be the nicest thing you've ever said to me. And that really makes me happy because, as a periodontist, we have to do a lot of procedures that are perceived to cause a lot of pain. And once a patient thinks that they're going to have pain, it's very difficult to overcome that. And so I spent a lot of time finding out, what works, what doesn't work. Something that you turned me on to was a way for us to buffer the actual anesthetic injection that we give. And that's really decreased pain just from the get-go. So a lot of the time we can give anesthetic and patients don't even know that we gave anesthetic. And so it really starts there. Now, one of the other things that I think really has a huge role in whether or not patients have pain after surgery is, number one, how clean the surgery is, knowing, that we're doing the correct procedure for that patient, and then using the tools that we have available to us. So like I mentioned, the field of regeneration and biomaterials has come a long way. So I have quite a few tricks up my sleeve, in terms of the materials that I use that actually reduce pain after surgery. We have longer lasting anesthetics that we can use, as well as biologics. One of the things that we use quite a bit here, as you know, is PRF. So we can actually, take the growth factors from your own body, from your own blood, in a process that takes about 2 minutes. And the studies have shown that it reduces pain after procedure. So these are just some of the things that we do. Of course, there's more, but really just getting patients treated in the most predictable way possible, using the most modern technologies. We've come a long way. Things don't have to be painful.